Hey, I'm a psychiatrist, and something incredibly important I've learned in my years of medical and mental health training is to never assume someone only has ADHD just because they struggle with focus issues. Now, something a lot of folks miss is a recent research paper found that up to 70% of people with autism may also have ADHD. And when you only treat one of these conditions, the other half stays broken. Today, I'm showing you two major symptoms that create a lot of the confusion and how you can differentiate them. If you're new here, my name is Dr. J, and I'm a medical doctor specializing in psychiatry with one absolute goal, and that's to make mental health make sense for you. Now, our very first symptom bucket is executive function challenges, and things already start to get muddy because executive function problems are basically the hallmark of ADHD, but they show up in autism as well. The key here is through different mechanisms. Executive function is your brain's management system. It handles things like planning ahead or organizing tasks or shifting between activities and even controlling impulses. Think of it as the CEO of your brain, making sure everything runs smoothly. In ADHD, the executive function struggles are front and center. The brain's dopamine and norepinephrine systems, which help with attention, motivation, and impulse control, they just aren't working well, which means someone with ADHD might start 5 projects and finish none of them, or they might lose track of time constantly, or just find that it feels impossible to get started on a task, even when they know it's super important. It's extremely important to note that there is significant evidence showing that these executive function issues are generally not biological in nature, and they are not what you would call a character flaw. It's also not laziness like many people think or feel about folks who struggle with ADHD. Now, one good way to think about this symptom is that it's the brain's wiring making certain tasks feel way harder than they should be. But something folks don't realize is people with autism also struggle with executive function challenges. And that's because autistic brains tend to be less flexible when shifting between tasks or mental states. This is sometimes called cognitive rigidity. For example, an autistic person might have incredible focus on something they're super interested in, including states of hyper focus that honestly put everyone else to shame. But then they struggle intensely when they need to switch gears or adapt to change in routine. The difficulty isn't attention or impulse control like in ADHD. It's more about the brain preferring predictability, and therefore they end up finding transitions really distressing. Okay, let's work through a scenario to highlight this. Imagine someone named Bob trying to get ready for work in the morning. If Bob has ADHD, Bob might start brushing his teeth and then notice that his phone is ringing. So they check a notification and then start replying to a text. Then remember, oh, I need to make coffee. Then Bob goes to the kitchen, sees some dishes, then start washing one dish, and gets distracted, and now Bob is running 20 minutes late to work and still hasn't finished getting dressed. The problem is attention regulation and impulse control because your brain just keeps jumping from one thing to the next without completing the current task. Now, if Bob has autism, the morning routine might look totally different. They might have a very specific sequence of events that they follow every single day. For example, Bob showers, then coffee, then he gets dressed before picking up your bag. And if something disrupts that sequence, let's say for example, Bob ran out of coffee or someone moved their work bag, now suddenly the whole morning just falls apart. As you can imagine, Bob isn't quite as distracted as the other Bob with ADHD. Bob is mostly thrown off because the change in his routine violated the predictable structure that his brain was expecting. And the rigidity makes it difficult to adapt on the fly like most people will be super comfortable doing. So it's not surprising that when someone has both ADHD and autism, they get both patterns. They struggle with the attention and the impulsivity, and they struggle with the flexibility and the transitions, which is genuinely exhausting for them because you're fighting your brain on multiple fronts, the ADHD side and the autism side. And one might ask, why does it make a difference for treatment? Can't we just do the same thing to help both people? Hit 2 birds with 1 stone. Well, for ADHD, stimulant medications or strategies that externalize structure like timers or checklists or body doubling, which is a really cool concept by the way, and I'll make a video about ADHD structural interventions in a few weeks. But Anyway, things like timers, checklists, and stimulant medications can actually improve executive function significantly for folks with ADHD. Now, for autism, on the other hand, what helps is creating more predictable routines, giving advance notice before transitions, and reducing sensory overload that makes flexibility even harder. As you can understand now, if you only treat one side of the equation alone, you're leaving the person still struggling with the other half. Our second symptom bucket is something termed sensory sensitivities. And this one really surprises people because most people don't think of ADHD as having a sensory component at all, but it absolutely does, just differently than autism. In autism, sensory processing differences are a core to this diagnosis. The brain processes sensory input like sounds, lights, textures, and smells in a way that can be overwhelming or underwhelming. Some autistic individuals are hypersensitive where everyday sounds feel painfully loud or certain fabrics feel unbearable against your skin, while others are hypersensitive where they seek out intense sensory experiences like spinning or crashing into things or needing very strong flavors, things like that. It's so important to stress that these aren't just preferences, they're actually neurological differences in how the sensory systems of individuals with autism register information. Now, ADHD also comes with sensory issues, but they're typically tied to attention regulation. For example, someone with ADHD might be hyper-focused on a task, super focused, completely tuning out everything around them, and then suddenly a sound or a light or a movement catches their attention and completely derails them. Or they might feel understimulated and seek out sensory input like fidgeting or needing background noise or bouncing their legs. And this is because their brain is trying to regulate attention and arousal levels. Overall, the sensory seeking ADHD is more about maintaining optimal stimulation for focus, whereas in autism it's about the sensory system itself needing certain types of inputs that align with the autistic individual's needs. Okay, let's drive this home with the scenario. I want you to picture a classroom. You have the fluorescent lights in the ceiling, you're buzzing as usual, kids are shuffling papers all around class, someone's tapping a pencil, and in that kind of environment, a student with ADHD in the same classroom might be distracted by all those sounds and movements, but not because they're painful, but more because their attention keeps getting pulled away. They hear the pencil tapping and their brain says, "Oh, what's that?" Or they see movements in the hallway and their focus shifts to that. The sensory input isn't quite distressing, it's just competing for their attention and winning all the time. Now, imagine when someone struggles with both ADHD and autism. They might genuinely find certain sensory inputs painful or overwhelming while also trying to filter out distractions. So they need both accommodations, like reducing sensory overwhelm through things like noise cancelling headphones or softer lighting, and strategies that minimize or just kind of help them maintain their focus. You see, the clinical approach changes depending on what's driving the sensory issue. For autism, we're looking at things like sensory integration therapy, environmental modifications, and helping the person develop coping strategies for when they feel overwhelmed. For ADHD, on the other hand, we're looking at attention management and tools that can help maintain focus and even medication to improve attention regulation. So here is the most complex point, and that's the fact that these two groups of symptoms I just walked you through, the executive function challenges and the sensory sensitivities, are some of the main reasons for diagnostic confusion. And that confusion has real consequences. For example, a kid might get diagnosed with ADHD and then they start a stimulant medication and see improvements with focus and impulsivity, but they still struggle socially because the underlying autism wasn't identified. Or an autistic adult might get all the social skills training in the world, but still find daily tasks overwhelming because their co-occurring ADHD executive function struggles were never addressed. The tough truth is about 50 to 70% of autistic individuals also meet criteria for ADHD, and that is not a small overlap at all. That's a massive intersection needs to be assessed for routinely. If you found this video helpful, then you want to watch this video right here that goes into another extremely important important overlapping symptom in ADHD and autism termed social difficulties, and I walk you through how to tell them apart in both illnesses. Now, don't forget to subscribe and comment one thing that this video brought to mind for you. I read and respond to every single comment, and I can't wait to hear your thoughts. I'm Dr. J, and this has been Mental Wealth MD. I'll see you in the next video. Peace.